Feel like a change, or do you like things the way they are? Either answer is acceptable when it comes time for Medicare open enrollment, but both require some review. Abby O'Brien is here to review for us the options that are available and why they need our attention now. Abby is the Director of Broker Sales, Individual and Government Programs for Medical Mutual of Ohio. So welcome back to the show.
So great to be here, Lori. Thank you.
So why is Medicare open enrollment so important?
So it's so important because if you have Medicare, this is the time of year where you can evaluate what you have, make sure it's working for you, and if you want to make a change to a Medicare Advantage plan, you have until December 7th to do that. So still plenty of time, and if you did choose to do that, it would start January 1st.
Okay. So what's the difference between traditional Medicare and Medicare Advantage?
Yeah, this is important. So traditional Medicare is the federal program that the government set up back in 1966. So it consists of Medicare's Part A and B, A being your hospital coverage, B being your physician services. So original Medicare doesn't cover prescriptions. So if you have original Medicare A and B, you'd want to think through how you're accessing your prescription coverage, and that would be through Part D. It does give you the flexibility to go to any doctor or physician that accepts original Medicare, but that doesn't have an out-of-pocket max too. So that's another thing to consider if you just have original Medicare A and B. And what some do is they enroll in a Medigap plan to fill that gap, and then a Part D with that. So that's one way to cover yourself.
Okay.
But another way is through a Medicare Advantage plan. And a Medicare Advantage plan takes those A and B benefits and typically covers the prescription through Part D and puts them into one plan. And so, for example, at Medical Mutual, we also add dental and vision benefits to that and some wellness benefits. We have a great partnership with Silver Sneakers, and that gives our members access to fitness centers across the country at no additional cost to keep them healthy, and they can yoga programs, swimming programs, walking programs. So it's been a big hit for our members, the Silver Sneakers program.
Okay, traditional or plus a few maybe other benefits, just something you have to choose from. So what should we be looking for in a Medicare Advantage plan?
Sure, so first you have to have Medicare's Part A and B before you could be eligible for a Medicare Advantage plan. And certainly you want to think through all of your costs first and make sure the premium makes sense, your prescriptions are covered, but it's also important to note that Medicare Advantage plans do have networks. So I can't emphasize enough the importance of before you look at a plan, make sure your doctors are covered by that plan. Or if you're changing to another plan, there would be no disruption with that. So that's key to the difference.
How about prescription drugs?
So yes, and that's another important point. I'm glad you brought that up. So you'd also want to make sure before you're making a change that there won't be an impact on how your prescriptions are covered as well.
Okay, and also Medical Mutual offers HMO and PPO plans. So even more things we have to worry about. What's the difference there?
Exactly. So a PPO plan or a preferred provider organization plan does give someone the flexibility to step outside of that network and still have coverage, but you're going to pay more premium for that, and your benefits are going to be less when you go outside of the network. An HMO plan, you have to stay within the network, but benefits are usually richer and your premium's going to be less. Of course, if there's an emergency or an urgent care service that's needed, that's going to be covered on an HMO plan.
Okay, so it seems like there's a lot of options. What if we have questions about what to do?
Yeah, so a great resource is the federal government's website, Medicare.gov, and they have a tool that's called the Medicare Plan Finder. And based on where you live, you can put in your zip code, you can put in all of your prescriptions, and it will do an analysis of what plans are available to you based on where you live and what your monthly and annual costs would be for that plan. But I wouldn't recommend making a change without talking to someone, right? So we have licensed agents available directly that you can talk to over the phone that can help you navigate through that. They'd be willing to come and work with you face to face, any of your viewers if needed. And then certainly it makes sense to also ask your current agent that you're working with. We have many across the area independent insurance agents that are representing our Medicare Advantage plans as well.
All right, well, thank you for great information. You're welcome. If you have a current Medicare plan, the question now is, should you stay or should you go? You have time to research and review before rendering your answer, but don't wait too long. Medicare open enrollment ends December 7th. My thanks to Abby O'Brien for making us aware of our options.
Learn more about Medical Mutual of Ohio by calling 1-844-606-5387 or visit www.metmutual.com/go.